Greetings, brethren, greetings, brothers and sisters, our colleagues, and our friends. As we close this year, 2025, we have seen many good things happening within the year here in Matany, and we have seen a few issues that have been here and there. We've lost a few friends. May God protect their souls, and may His light shine upon them. And we've seen others, our patients and the rest, being able to go through the year alive and well, just all because of God's protection on us. Then we see that in the special clinics alone, when you add them plus the patients we've seen in the normal outpatient, we've had over 119,000 patients seen. These are all lives changed by everyone. So to the clinicians in OPD who handle this work and the nurses, we thank you very much. It's your dedication that ensures that whether a patient comes from Matany or from anywhere else around the world or around the country, we are able to handle them and give them the best care they can, or we can give them and what they can get out of it all. And we do all this with dignity and a lot of respect. So thank you very much for the work you're doing. We also have still a lot of victories to celebrate. And when we look at this, we look at our maternal and child health care that we have been able to extend to our patients. If there's one area that we can really look at, it's this. We've seen achievements and increases in numbers of the patients we've seen at natal care and those ones we have delivered, including also our neonatal intensive care unit. We saw a reduction in maternal mortality, because in the last financial year alone, that's the financial year of 2024-2025, we realized that we handled nearly 3,000 mothers who came here to deliver, and that is a big number. And amongst all those, we only lost one mother during all this time because of circumstances which we could not completely alleviate. But I know in everything, everyone did their best to make sure that all the best is done. And this speaks a lot in terms of your vigilance to the mothers and the patients, and also your skills in midwifery and in the obstetrics teams. So thank you very much. And we saw that the trust our community has with us has been much better over the years, but also this year it has increased. We saw numbers increasing with that natal care. If you find a hospital like ours having a leap of over 25% in antenatal care, the fourth antenatal care visit, that's a very good thing compared to the previous year. And this is the same with our deliveries. The mothers who have come to deliver with us, more and more are coming every other year, and this is a lot of trust. We celebrate our neonatal intensive care unit, very important. Thanks to the QAM teams, because they're the ones who solicited the money that built the neonatal intensive care, and this was with the help of the Irish Embassy. We thank you very much. This is currently fully operational, and it's a department of its own, still a little attached to maternity, but it's working in its best. And they managed to discharge from the neonatal intensive care unit 372 babies, and that is by the end of the last financial year, and that is very commendable work. These are vulnerable lives which without this they would have been lost, and these are families which would have been sad because of these losses. And we have increased and made sure that more and more, much more productivity comes into the world and to this country. We still have burdens that will disturb us, and that's mainly the diseases. The disease burden is still high. Malaria remains the fiercest opponent we have, and it accounts for over 7,200 OPD visits and over 2,721 admissions, and this is a high number. And while we fight it in the wards, this war should be extended to the communities. We can't fight malaria only within the hospital, so we need to work together with the community and our community health department to see that this is achieved. We also saw that respiratory diseases increased, where we see that pneumonia alone claimed 47 lives in the year, and this is the problem. We need to see how we can also handle this, and we must be very vigilant in making sure that we handle these problems to the point that we reduce the numbers, both of those who get sick, but also of those who die. And this starts right from the community and then comes back to the hospital. On a positive note, our fight against HIV has continued to yield some fruit. Our positivity yield in all the cases we tested, more than 7,000 patients, we only had 0.29% positivity yield. This is a good thing. Like I said, many of these things start right from the community: sensitization, provision of access to facilities and Medicare. And by the time it comes to the hospital, we see a lot of improvement, basically. And we've seen that in our elimination of mother-to-child transmission of HIV, we had 0 HIV positive babies. When we do the early infant diagnosis, we had 0, basically. None of our babies tested positive for HIV, and that is very, very commendable for both the antenatal teams, the maternity teams, and the ART teams. So thank you very much. When you look at our diagnostics excellence, that's the laboratory and the X-ray department, or the radiology department, we've done a lot. Our ability to treat effectively relies so much on these departments. And we are able to diagnose accurately because we are able and treat because of these departments. I want to commend the laboratory team. They performed over 147,000 tests just in the last financial year. And notably, our screening for tuberculosis was expanded massively. The gene experts alone handled over 11,000 tests that were conducted. The imaging department, they did over 14,000 ultrasound scan examinations, and this is very, very commendable work. All this helps us to make sure that we treat what we know and we get better results out of it. All good said, we still have challenges along the way, and these we need to handle as we go ahead. I want to conclude by saying, as we look into the new year, our priorities are really, really clear. We don't have a reason to doubt. We must manage our space and financial constraints. That is something I've already talked about. And continue to aggressively handle those infectious diseases that we are handling or we are seeing. But as we handle the infectious diseases, there is also something that is coming up, and that is antibiotic resistance. We need to know that we don't need to use medicines irresponsibly, because a time will come when these medicines that we are using now are unable to help us in the future if we use them irresponsibly. So let us work together to make sure that everything that we do has a plan in the future and can still help us within the near future. I thank our technical department who have done a lot of work to make sure they maintain the hospital the way it is. Through the mechanics that they do, the constructions they are doing, the repairs, our BME department, the biomedical engineering department, for all the work they have done. Because without them, everything would have failed and we wouldn't have been able to handle our patients well. I want to thank the government of Uganda for the help, the extra help they give us financially through the PHC funds. Very important. Our developmental partners, especially QAM, JMS, and also UCMB, very important, and all the others, including UHA, and others who are around us, Baylor and the rest. We thank you very much, and all our benefactors around the world and also within the country. But mostly, I extend my thanks to the staff. They have done a lot of work this year, from the cleaners who keep their environment clean and very safe for everyone, the patients and the fellow staffs, to the specialists in their theaters who perform nearly 900 major operations within the last financial year. We thank you very much, plus all the nurses, everyone, including the administrative departments, and all the rest. We thank you very, very, very much for all the work you've done. You, as the staffs, are the hands and the feet of this mission. May Saint Kizito continue to intercede for us as we move forward, and may we continue to serve everyone with love. Thank you very much for all the work, and thank you for being there to handle the patients, handle each other, and keep each other standing, and keeping Matany Hospital moving forward. May God be with us all. Thank you very much. God bless you.